My name is Jocelyn Aguilar. I'm 40 years old and I live in South Pasadena, California. I went in for a regular well-woman visit, and at that time I requested a mammogram only because I have a family history of breast cancer. So my doctor at that time did order the mammogram for me. I went and had it done. 2 days later, she calls me and she says something was seen on the mammogram and to go in for a diagnostic mammogram, which I did, which then was followed by a biopsy, which then confirmed that I did have breast cancer. Well, of course, I was shocked. I was only 37 years old. I was a single mom at the time. So I was very worried about my daughter at home and how that would also affect her. Receiving my care at USC Verdugo Hills Hospital, I just felt very comfortable knowing that Dr. Nelson was there to take care of me, that she pretty much set up most of my team and referred a plastic surgeon for me at the time as well. And then I spent a night in the hospital a day after surgery. So those nurses that took care of me overnight as well were people that I actually trained with when I was a brand new nurse. So I felt like I was being cared for by family, so it was amazing. I continued treatment with chemotherapy at USC Norris Comprehensive Cancer Center in downtown LA. They took really good care of me there as well. After chemotherapy, I was started on hormone therapy. I was on a medication called tamoxifen, and it is not recommended to get pregnant on that medication. But my oncologist agreed that I can be on the medication for 2 years and because of my age, and then try to conceive then. So my partner and I decided that we'd go on a cruise to Mexico in August. And in August, when we came back from the cruise, we found out that we were expecting. Considering all the things that have gone on and knowing that at some point, the doctors were saying this may not be a possibility. So we are super excited. My daughter's name is Bella. She's becoming a little bit more excited now that she gets to be a big sister. Don't be afraid to get tested. Hearing that you have cancer is obviously a scary thing for anybody, but you don't want to find out when it's too late. So get tested.